There are several factors involved when choosing a Medicare Advantage plan. In this video, we're going to cover what those factors are and how to approach choosing the right Advantage plan for your specific needs. Hey guys, Alex Wender here from Blue Wave Insurance. We help folks across the country with their Medicare plans. Feel free to give us a call or book an appointment using the link below at any point during this video for free help with your Medicare. So the main factors when choosing a Medicare Advantage plan are making sure your doctors are in the network and your medications are covered. But before we get into those details, let's cover some basics for Medicare Advantage plans first. Medicare Advantage, also known as Part C, will take over your Medicare and become primary. This means the Medicare Advantage plan will manage your Medicare and you will need to stay within a network of doctors, and you may have various out-of-pocket costs such as co-payments for different services. In order to have a Medicare Advantage plan, you will need to have Medicare Part A and B in place. This means you will generally have to pay a premium for your Medicare Part B. Medicare Advantage plans are generally zero premium per month and do include prescription coverage, and most of the time they do include some sort of dental and fitness benefits as well. Most Medicare Advantage plans come in the form of an HMO or PPO plan. An HMO plan requires you to choose a primary care doctor, and referrals are generally required to see a specialist. The specialist also may need to be in the same medical group as your primary doctor with an HMO. There are some HMO plans out there that don't require referrals, and those plans are limited on where you live. They may or may not be available. Also, with HMO plans, there's usually no out-of-network coverage unless there is an emergency. PPO plans will give you more freedom than an HMO plan. With a PPO, you can see any doctor in the plan's network without a referral. This includes specialists and primary doctors. PPO plans generally provide out-of-network coverage. However, if you do go outside the network, the co-payments and co-insurance costs are much higher than if you were in the network. Cost-wise, HMO plans will generally have lower out-of-pocket costs versus a PPO plan, but you will have less freedom than a PPO plan, so essentially it's a trade-off. So now we've covered the basics, let's talk about choosing the right Medicare Advantage plan. The first step when choosing a Medicare Advantage plan is to make sure your plan has their doctors in their network. In addition, if you're looking at an HMO plan, you may need to make sure that your specialist and primary doctor are in the same medical group, so your primary doctor can refer to your specialists. If you're looking at a PPO plan, you just need to make sure they're all in the network, not necessarily the same medical group. The way we help our clients is we plug all the doctors into our system and run a search and make sure that the plans we're considering has all our clients' doctors in the network. And if it's an HMO plan, we double check to make sure the doctors and specialists are in the same medical groups. Those primary doctors can refer to the specialists. Now, the plans do change from year to year, and the networks and the doctors may change. So it's important you do keep an eye on your plan and check every year to make sure your doctors will still be in the plan's network for the following year. The time to check is during annual enrollment period, which is between October 15th and December 7th of each year. This is the time you can change your Medicare Advantage plan from one plan to another, or go back to original Medicare with an effective date of January 1st of the following year. The second most important thing to consider when choosing an Advantage plan is that your prescriptions are covered. Each Medicare Advantage plan has a different formulary for the drugs they cover. So in addition to checking your doctors, we take our clients' prescriptions and plug them into our system and check to make sure the plans we are evaluating cover their prescriptions, and we want to know what the co-payments and deductibles and out-of-pocket costs will be. In addition to the prescriptions being covered and knowing what the out-of-pocket costs will be, we also want to make sure the pharmacies that our clients want to go to are covered as well. So after you've narrowed down the plans based on doctors being in the network, prescriptions, and pharmacies being covered, we want to know what the out-of-pocket costs are as well. So what's it going to cost you in the hospital? How much is an outpatient surgery going to cost? What's a co-payment at the doctor's office? And all the other services the plan will provide you will have an out-of-pocket cost. So you can find this in the plan's summary of benefits. Lastly, when choosing a Medicare Advantage plan, you want to make sure you check to see what sort of extras the plan might have. Maybe it has dental, vision, hearing, maybe it has fitness benefits. So you can see that in the summary benefits as well. So there you have it, all the things you need to check before you enroll into a Medicare Advantage plan. Again, the doctors and medications are most important, followed by the out-of-pocket costs on the plan. Unfortunately, we talk to folks all the time who either blindly signed up for a plan or some agent called them in a call center and signed them up without checking any of this stuff. So it's very, very important that you check this stuff before you enroll. You do not want to be surprised when you go to use a plan that either your doctors aren't covered or you go to the pharmacy and your medications aren't covered. So it's not hard to do. We do this for free for all of our clients, and we'd be happy to help you out. You can book a call with us using the link below in the description, or you can call us at the number below. We'd be glad to help you out. If you enjoyed this video, don't forget to click like and subscribe below to stay updated on all things Medicare and the latest changes. Thank you for watching, and we'll see you in the next video.